Hello, this is Dr. Sangavi from Sri Balaji Dental College and Hospital, Department of Conservative Dentistry and Endodontics. The topic of the presentation is dentin bonding agent. Coming to the introduction, the word adhesion is defined as the state in which two surfaces are held together by interfacial force, which may consist of valence force or interlocking force or both. Adhesive is a material, frequently a viscous fluid, that joins the two substrates together by solidifying, resisting the separation, and transferring a load from one surface to the other. Adhesive strength is the measurement of the load-bearing capacity of an adhesive joint. Coming to the mechanism of dental adhesion, it can be either mechanical adhesion, which is the interlocking of adhesive and the adherent. It happens by irregularities, or else the absorption adhesion, which is a chemical bonding, which takes place by the primary valence or the secondary valence force. And finally, the diffusion adhesion, it is the interlocking between the mobile molecules such as adhesive of the two polymers through diffusion polymer chain and across the interface. Key steps for the development of good adhesion are clean adherent, good wetting, intimate adaptation, bonding, and complete curing. Coming to the contact angle, the zero contact angle is the best to obtain wetting. For a good adhesion, the contact angle should be less than 90°. Lower the contact angle, better the wetting. Mechanism of dentin bonding agent. So the dentin bonding agent has both hydrophilic and the hydrophobic end. The hydrophilic end displaces the dentinal fluid, whereas the hydrophobic end bonds to the composite resin. Coming to this diagram, M is the double bond of methacrylate which copolymerizes with the composite resin, and R is the spacer, whereas X is the functional group which bonds to the inorganic and organic portion of the dentin. How is the inorganic portion of the dentin bonding takes place? It occurs due to ionic interaction between the positively charged calcium ion on the dentin surface and negatively charged on the group X of the adhesion. Group X can be either phosphate, amino acid, amino alcohol, or dicarboxylate. Usually it is the phosphate group. Bonding to the organic part of the dentin. In dentin collagen, we have amino group, hydroxyl, carboxylate, and amide group. Whereas in dentin bonding agents, we have isocyanates, aldehyde, carboxylic acid, anhydride, carboxylic acid chloride. These replaces the hydroxyl group or the hydrogen group from the above mentioned groups of the dentin collagen and bonds chemically. Wet bonding. It was introduced by Kanka and Punnett in 1990, refers to the bonding in which acid-etched dentin is moist and hence acetone-based primers are used. Acetone and ethanol-based primers displaces the water and carry the monomer in between the exposed collagen. The primary solvents are then evaporated by the gentle air drying, leaving the active primer monomer behind. The technique is do not dry the dentin. High volume evacuation is used. Rewetting can be done by 35% of hydroxyethyl methacrylate or chlorhexidine. Whereas the drawback is technique sensitive evaporation of acetone, increased monomer ratio, decreased penetrability of the monomer. To overcome this problem, acetone based adhesive formulations are available in predisposed dosed single patient use capsules. Coming to the dry bonding, it refers to the bonding in which acid etched dentin is dry. So water-based primers are used. Water-based primers are not dependent on the moist dentin because of their ability to self-wet a dry wet dentin surface, thus separating the collapsed collagen fiber. Hybridoid region or a ghost hybrid layer. It is the area of the demineralized dentin in which the resin fails to penetrate due to collagen collapse. In dry bonding technique, if water-free acetone-based primers are used, they do not effectively infiltrate the exposed collagen network, resulting in due to the absence of water. This reduces the bond strength. What happens in overwetting phenomena? If solvent of the primer fails to remove the water completely from the dentin, excessive water dilutes the primer, reduces the effectiveness of the primer, and dentinal tubules are more prone to show the phenomena than the intertubular dentin due to their high volume water content. The dentin surface may appear like a blister like water being trapped beneath the resin layer. Coming to the bond strength, shear bond strength of the composite resin to the phosphoric acid etched enamel usually exceeds 20 megapascal. Such bond strength provides adequate retention and prevents the leakage. Dentin adhesion. Dentin is composed of different volume fraction of inorganic, that is calcium hydroxide, proteins, and water. These three phases creates the basic building block of bone and teeth. Collagen, a triple helical protein, self-organizes into bundle called fibrils. These fibrils are well organized and contain regularly spaced regions of high and low protein density called the overlap and gap zone respectively. The HAP crystals, that is hydroxyapatite crystals, are believed to then grow within these gaps, reinforcing the weak collagen structure. Coming to the smear layer, it is a residual organic or inorganic component formed when the tooth is prepared using a burr or an instrument. It was first suggested by Skinner and it was coined by Boyd. It is usually 0.5 to 2 micrometer thickness, granular and irregular in structure, and when present on the dentin extends the dentinal tubule to a depth of 1 to 10 micrometer, forming the smear lug. It has two components, the superficial smear layer and the smear plug that occludes the dentinal tubule. Factors affecting the formation of the smear layer: speed, that is the high speed instrumentation, and type of instrument where the coarse diamond burr produces thicker smear layer than the carbide burr. Reason for removal: it has an unpredictable thickness and volume because of a greater portion of it consists of water. It contains bacteria and it may act as a substrate for bacteria, allowing their deeper penetration in the dentinal tubule. It may limit the optimum penetration of the disinfecting agent. It acts as a barrier between the filling material and the canal wall. It is a loosely adherent structure and potentially avenue for leakage and bacterial contamination passage between the root canal filling and the dentinal wall. Reason for retaining. Conversely, some investigators believe in retaining the smear layer during canal preparation because it can block the dentinal tubules, preventing the exchange of bacteria and other irritants by altering the permeability. Pashley suggested that if the canals were inadequately disinfected or if bacteria contamination occurred after the canal preparation, the presence of smear layer might stop bacterial invasion of the dentinal tubule. Bacteria remains after the canal preparation are sealed into the dentinal tubule by smear layer and subsequent filling material. Dentin bonding agent. So, it is defined as a thin layer of a resin applied between the conditioned dentin and resin matrix of a composite. Due to the difference in the composition of enamel and dentin, bonding agent that will be adhered to the dentin was a challenging due to the following reason. The higher the water content interface with the bonding, presence of a smear layer on the dentin surface. So whether it should be a hydrophilic or a hydrophobic. The bonding agent should be hydrophilic to displace the water, permitting it to penetrate the porosity in dentin and react with the inorganic and organic compound. But restorative resins are hydrophobic. Therefore, the bonding agent should contain both hydrophilic and the hydrophobic component. Hybrid layer. Hybridization of dentin is a process which creates a molecular level interface between the underlying dentin and the overlying composite. This interface is neither tooth nor resin but a hybrid of the two known as hybrid layer. This layer is formed not only on the surface but also within the substrate. According to Nakabayashi in 1982, hybrid layer is defined as the structure formed in the dental hard tissue by demineralization of the substrate and subsurface followed by infiltration of the monomer and subsequent polymerization. This is the image of the hybrid layer in the dentin bonding agent. You can see a adhesive layer, a hybrid layer, the lateral canals and the intertubular and peritubular dentin. The topmost layer of the hybrid layer consists of a loosely arranged collagen fibrils. The middle layer consists of the collagen fibrils separated by an electrolucent space, represents an area in which hydroxyapatite crystals have been replaced by resin due to hybridization, and the base consists of a partially demineralized zone of dentin that is infiltrated by resins. Classification of dentinal adhesives. Coming to the first generation, it was introduced in the year 1956. It consists of surface active co-monomer N-phenylglycine glycidyl methacrylate. It is a bifunctional molecule or coupling agent. This means that one end of the molecule bonds to the dentin while the other to composite resin. Mechanism of action: this co-monomer could chelate with the calcium on the tooth surface to generate chemical bond of resin to calcium. Example, Crevident. Reason for the clinical failure: it did not take enamel etching into consideration and the bond strength was very weak, that is 2 to 3 megapascal. Coming to the second generation, it was introduced in 1978. They were based on the phosphorus ester of methacrylate derivatives. Mechanism of action: Or the adhesion was by means of ionic interaction between the negatively charged phosphate group and positively charged calcium in the smear layer. Example, clear fill bond system, Scotch bond light, Prisma universal bond. Advantages: bone strength was 3 times higher than the earlier one, whereas the drawback is the bone strength was still low around 5 to 6 megapascal. Clinical failure due to the bonding's instability in the wet oral environment and the primary bonding to the smear layer and not to the dentin. Large contact angle with the smear layer did not allow penetration of the bonding agent into the superficial dentin to establish a ionic bonding resin extension into the dentinal tubule. Coming to the third generation, it was a phosphate based material containing a HEMA and 10 carbon molecule, that is 10 methacryloxy dicyl hydrogen phosphate. They were introduced with clear fill new bond in 1984. Mechanism of action is the concept of phosphoric acid etching of dentin before the application of phosphate ester type of bonding agent was put forward by Fusayama et al. In 1979. Most of the third generation bonding agents were designed not to remove the smear layer but only to modify it, and therefore it allows the penetration of an acidic monomer like phenyl dipentaerythritol pentacrylate monophosphate. The component of this generation consists of an etchant, a conditioner, a primer, and an adhesive. The bond strength was 3 to 8 megapascal. Examples are clear fill new bond, scotch bond. This generation attempted to deal with both the smear layer and the dentinal fluids with following two approaches. Smear layer modification to improve its property removes the smear layer without disturbing the smear plug that occludes the dentinal tubule. Conditioning of the dentin. So before going to the fourth generation, let's talk about the condition of the dentin. It is the etching of the dentin surface with acid, calcium chelator, etc. So when the acid is applied to it, dissolution of the hydroxyapatite crystals in intertubular dentin and outer surface of the peritubular dentin occurs. Ultimately, the smear layer gets removed and the collagen fibrils are exposed. Changes after conditioning are removal or modification of the smear layer, opening of the dentinal tubule orifice, exposing the microporous collagen network, and decalcification of the organic portion. The chemicals used are acid and calcium chelators, thermal mechanic by a laser, and mechanical by abrasion. The primer. Primer is a bifunctional monomer in a volatile solvent such as acetone or alcohol. Example, hydroxyethyl methacrylate, N-methacrylate, 5-amino-salicylic acid, and etc. etc. Main actions are: it links the hydrophilic dentin to the hydrophobic adhesive resin, promotes the infiltration of demineralized peritubular and intertubular dentin, it increases the wettability of the conditioned dentin surface. Adhesive resin. It is an unfilled or a partially filled resin and may contain some components of the primer in an attempt to promote the increased bond strength. Main actions are: combines with the primer's monomer to form a resin reinforced hybrid layer that is 1 to 5 micron thick. It forms a resin tag to seal the dentinal tubule. The examples are hydrophobic monomers such as beach GMA and UDMA, and diluent like triethylene glycol dimethacrylate, and wetting agent like hydroxyethyl methacrylate. Coming to the fourth generation as a known as the total etch technique or etch and rinse technique or a three-step total etch technique system. This generation relied on the total elimination of the smear layer and the smear plug. Clinical steps were also simplified by using a phosphoric acid etch to etch the both enamel and dentin. This concept of total etch technique was introduced by Fusayama in the year 1976. This adhesive system consists of three components, namely the phosphoric acid etch, the primer, the adhesive bond strength of 13 to 30 megapascal, example Scotch bond multipurpose, bonded, pro bond, Luxa bond, and total etch. The advantages of fourth generation are proven effectiveness of adhesive and consistent result, highest bond strength. Drawbacks are risk of overetching the dentin, time consuming, post conditioning rinsing is required, and weak resin collagen interaction leading to nano leakage and early bond degradation. Coming to the fifth generation, this was developed to simplify the procedure involved in bonding. Here, the primer and the adhesives are provided in a single bottle. The etch and rinse phase was followed by the application of the primer adhesive solution. The bond strength was 3 to 25 megapascal. The examples are prime and bond NT, add per single bond, excite, one coat bond, XP bond, etc. The advantages are simple application procedure, consistent and stable composition, controlled solvent evaporation when providing in a single dose package, cross contamination is avoided. Drawbacks are application procedures still required time technique sensitive due to multiple layer application, risk of a very thin bonding layer, sensitive to overwetting and over drying, weak resin collagen interaction, low bonding effectiveness than the three-step etch and rinse system. Coming to the sixth generation is the categorized by omission of the etch and rinse step and introduction of self-etch primer and adhesive system. It is also known as non-rinsing conditioner or self-etch priming. In contrast to conventional etch, self-etching primer are not rinsed off. This reduces the possibility of overwetting or overdrying, both of which affects the adhesive adhesion adversely. These materials combines the tooth surface etching and priming step into single step procedure. The mechanism of action: these acidic primers contains phosphonated resin molecule that performs two functions: etching and priming of the enamel, incorporation of the smear plug into the resin tux. Steps involved are application of bottle 1 after 10 seconds, application of bottle 2 that consists of adhesive, whereas bottle 1 consists of etchant and primer, and then light cure it. Examples are clear fill, adhesive, etc. It has two categories. Type 1 is self-etch primer and adhesive. It is a two-bottle system. Components of both the bottles are applied separately. That is, self-etch primer applied first, followed by adhesive. Example, clear fill. Whereas in type 2 self-etch adhesive, two-bottle system. Components of both the bottles are mixed first and then applied. Examples, Cano 3, 1-up bond, prompt L bond. The advantages are no etching is needed, less technique sensitive, self-adhesives are less likely to result in discrepancy between the depth of demineralization and depth of resin infiltration, as both are done simultaneously, and less time consuming. Whereas drawbacks are decreased shelf life, incompatible with chemical cure composites, self-etch adhesives that are currently available do not etch as efficiently as phosphoric acid. The last is the seventh generation, that is etchant, primer and adhesive in a single bottle. Both hydrophilic and hydrophobic components are intricately mixed in the system. Example, I bond, G bond, clear fills, etc. Advantage are most time efficient application procedure, unidose application, simultaneous demineralization and resin penetration, less sensitive to dentin wetness condition. Whereas drawbacks: prone to phase preparation, entrapment of droplet of water in the adhesive layer, increased hydrophobicity, reduced shelf life, less sealing capacity, less bond strength, incompatibility with autochemical curing composites, no long-term clinical evaluation studies. So these are the history of the bonding agents and their important features. And now is the 8th generation. The new technology features a bonding system which is contained within the composite resin restorative material. A self-etching, self-adhering flowable composite technology eliminates the need of separate bonding application step with composites for direct restorative procedure. In this, there is a separate stable nanofiller that will not settle out dispersion. Example, vortice flow, single bond, opti bond, etc. Thank you.